Good afternoon, Solutions family. Today is a discussion on plantar fasciitis. As a chiropractor, I like to look at the different arches. There's 3 arches in your foot, and it basically absorbs shock every time you take a step. And so what we're looking at is this medial arch, and this is the one that people think about a lot. But there's also a transverse arch and a lateral arch, and that's what creates that tripod so that you're able to absorb shock every time you take a step. As a chiropractor, I do like to make sure that the structures are intact, and so many times we'll adjust your foot. But when there becomes adhesions or irritations in the musculature or the fascia, you say words like plantar fasciitis. So if that's the case, many times people will check with their physical therapist. We can do things like,
so when somebody comes in for plantar fasciitis, a lot of times they'll have the pain at the heel of their foot. We'll use different techniques such as dry needling or using the tool for scraping or stem, which will treat the calf and also along the bottom of the foot. And that's kind of like a deep tissue scraping. We can do some dry needling just at the bottom of the foot there and address that trigger point directly. Sometimes we'll do dry needling up and through the calf because a lot of times calf tightness can affect what's going on at the foot. Also, icing, and my preferred method when it comes to something like plantar fasciitis is with ice directly on that foot and just moving around, and that really helps with that irritation or that inflammation that's going on in there for sure. And then there's also taping techniques that we can use as well to stabilize that arch and to give that relief for the plantar fasciitis.
and extra support. Perfect. So if you've got pain in the bottom of your foot, it might be plantar fasciitis. Call your chiropractor.